Can I come in? Hello. How are you? I'm Miranda. I'm going to be your nurse today. It looks like we need to get an IV started on you. Have you ever had an IV before? You haven't? Okay. Well, it's just a little catheter that we're going to put in your vein, and it's going to help us to give you some medications. It looks like the doctors ordered you some just fluids and then an antibiotic. Okay? You have any questions? All right, care to tell me your name and date of birth? All right, you're just the man I'm looking for. Do you have any allergies to anything? No latex, no betadine, not that you know of. Okay. The other thing that I was wondering is there a particular arm that you prefer I stick, or a place that you know they've got you easily in the past? Okay. Have you had any surgeries on either arm? Is there a reason I can't stick you in either arm? So no fistula, no graft, nothing, never heard those. Okay. Yeah, never heard those before. That's good. Everything looks good. So I think I'm just going to start and look over here if that's okay with you. Perfect. All right. I'm just going to go ahead and raise you up a little bit so that I can get to you. I see you have a pillow there that you're not using. Would you mind if I use that and put that under your arm? Thank you. I'm just going to have you raise your arm up here. Right. And then I also got this little drape that I'm going to put under your arm. That way we don't get blood on anything if we do see a little bit. Wonderful. Thank you. All right. Stick on some gloves here. Got my stuff ready. I have some students here with me today. Would you mind if they come in and watch me do this? Thank you. I'm going to kind of talk through some things with them, but if you have any questions when I'm talking to them, you just let me know. Well, I can get my glove on. Okay. The first thing I'm going to do is I'm going to open my IV start kit. And there should be a tourniquet in there. A tourniquet's just a little like rubber band that's kind of stretchy. And I'm just going to use this to make your vein pop up so that I can see where I want to stick you at. Okay, and I'm just going to do this, and I'm just looking right now. I'm not going to stick you yet. Once we find a vein, we'll set everything up and get started. Okay, so this is going to go about 4 to 8 inches above wherever I want to stick Mr. Smith at here. So he said that he prefers his forearm here. So generally we would start low and work our way up, but he prefers that he doesn't get it in a hand or a wrist. So I'm going to go ahead and look up a little higher. So I'm going to place my tourniquet here. Okay, this is going to be nice and tight. When I tie the tourniquet, I want to be sure that I'm tying it so that I can easily release it so it's not a knot. And so just one motion releases it. Okay. And then I'm going to go ahead and check his radial pulse. I just want to make sure that that tourniquet's not too tight. It's not occluding blood flow to his fingers in case I have it on there for a few minutes. Okay. Does that feel okay? All right. Let me look and see. Oh, I feel one right there. That one feels great. Okay. I think that's where we'll go. I'm going to go ahead and take this tourniquet loose. And then I'm going to go ahead. That's what had my tourniquet in it. It's also got my ChloraPrep, which I'm going to use to clean the site where we're going to stick the patient. It's got some 2x2s. I generally place that underneath the catheter once I get it inserted, just in case any blood leaks out. Some tape, and then a tegaderm. The tegaderm is what we're going to actually put over the insertion site. The insertion site's the most important part. We don't want to touch it or contaminate it or put tape that's not sterile on it. When you use the tegaderm, you're going to peel the back off. And then you're going to see this ring around it. Once you peel the back off and you place the dressing where you want it, then you will start to peel this top layer off. And there's also a date, time, initial sticker that you can put on the side of the IV once you get it started. But again, don't cover the insertion site. I have some alcohol swabs just in case. I have a J-loop. This is also known as an extension set. So it's like a 7-inch extension set. It allows me to be able to have a little room once I get that IV in to not have to work closely to the patient's skin. I have my IV catheter. I chose a 22 gauge IV catheter because my patient only needs, Mr. Smith only needs some IV fluids, and he's going to get a very mild antibiotic. And so the 22 gauge will work for his needs. When I'm selecting a gauge, I do want to take into consideration my patient's age, the medications they're getting, and their condition. I have a couple of saline flushes that'll help me to prime the J-loop as well as flush the IV if I need to. I've also brought a swab cap. Some places call these a Kuros cap, and this is just going to go on the end of my J-loop once I get the IV in. Okay, so the first thing I'm going to do is I'm going to go ahead and I like to open both of my flushes. Kind of keep my trash over to the side. Have both of my flushes open. The next thing I'm going to do is I'm going to go ahead and open my J-loop for my extension tubing. I want to make sure that this cap, so this is where my flush is going to go. I'm going to scrub that with alcohol before I put the flush on there. But that's where my flush is going to go. That's our lower lock. And this end is what actually screws into the IV catheter once it's in. This is sterile. So that part there, it has a cap on it because it's sterile. Scrubbing it with alcohol won't make it sterile again. So we do not want to touch that inside there. So we want to leave this cap on. Generally, I pull this part down and loosen the cap and then lay it down so that I don't contaminate it. I'm going to go ahead and scrub the hub. I'm going to scrub it for 15 seconds and then let it dry. I'm going to get my flush. I'm going to get the air out of it. And I'm going to go ahead and connect it to that end of my J-loop that I scrubbed. The next thing I'm going to do is I'm going to push the flush in order to get all the air out of the tubing, and you'll start to see the fluid kind of drip out, and I have no air in my line. So that's good. I'm going to set that back down, and again, just make sure that my cap is loose enough that it's very easy for me to get off, because my hand will be occupied whenever I'm trying to take that off. And I just need to be careful because I don't want to sit this down with the cap off because this isn't sterile. I've touched this and messed with this. So I'm just going to leave it on there like that and just keep it on the paper so I can see it. All right. The next thing I'm going to do is I'm going to go ahead and open my IV catheter. So when you're opening the IV catheter, you just want to be careful. So I'm going to pull that out. Our IV catheter that we have, it's a safety catheter. It has a cap on it. You can see it's blue because it's a 22 gauge. It has these little grips on the side. That's where I'm going to hold it when I'm inserting it. When I pop this cap off that's covering the needle, the first thing I'm going to do is I want to twist this, we call it a hub, the blue part. I want to twist that to make sure that the catheter isn't sticking to the needle. The other thing I want to do is make sure when I insert it with the bevel up. So there's a little hole in the top, that's the bevel. So I'm going to insert that with the bevel up. Whenever I'm inserting the IV, I'm going to insert it at about a 30 to 45 degree angle. And then once I get it in there, I'm going to drop it down a little bit until I get what I call flash or blood return. So in this little chamber here at the top, you'll start to see the blood, and that means you've got the vein. Once you've got the vein, you're going to stop advancing the needle, and you're just going to advance the catheter. And there's a little lip on top of your IV, and basically what you're going to do is you're going to push that forward. That pushes the catheter forward, and the needle remains in place. And then Once you've got that where you want it, the catheter or the needle pulls back and locks, and you prevents you from getting stuck. Okay. Remember, we decided we were going to pick this vein, so we've got it 4 to 8 inches above that. Do it with our little loop so we can get it loose easily. We've already got our chuck down just so that if you bleed any little bit, won't get on your bed. Okay. All right. I've got my other things here. The first thing I'm going to grab is my ChlorPrep. I'm going to crack it, and then I like to shake it a little bit. And then I'm going to work my way. So there's my vein. Once I clean it, I don't want to touch the vein. I can touch above the vein and below the vein in order to find it. So right there in the middle is where I want to stick it. So what I can do is I can feel the middle, and then whenever I'm preparing to stick the IV, I can feel below that, and then I'll know exactly where to guide my needle, but I still haven't touched the insertion site. Okay. So I'm going to go ahead and clean, working my way from circular motion, just working my way out. And remember, the drying part of the cleaning is the most important part. It's the part that's going to allow the bacteria or the germs on the surface of the skin to actually die. Okay, and I'm going to go ahead and I'm going to grab my needle back. So again, I'm just twisting that catheter since I've just opened this one, and making sure that the bevel is up. And then I'm going to go ahead and feel the bottom of that vein. I need to pull back. So Mr. Smith has great skin. His skin doesn't move at all. My skin does move. So if I try to stick without holding the skin down or taut, then it's going to move the vein and the needle isn't going to go in the correct place. So that's why I'm holding down or pulling down on the vein or the skin. I'm also kind of feeling exactly where the vein is with my thumb there so that I know where to guide my needle. Okay, so got it. And then pulling down, insert it at about a 30-degree angle there. And once I get it in, I'm going to drop it down a little bit, keep advancing until I see blood return there in my catheter or my chamber. Once I see blood return, what I'm going to do is I'm going to go ahead and advance the catheter. So again, that little thing on top, I'm advancing that. So just the catheter is going in. Just the catheter. Okay. Once the catheter's in, I'm going to pull back. So remember, I can touch the hub. I just can't touch the insertion site. So I'm going to hold the hub and I'm going to pull back on this part where my fingers were. That locks the needle. I'm going to go ahead and release my tourniquet. I'm going to apply pressure above the insertion site. My needle's out and I'm not touching the insertion site. This is preventing, when I pull this needle off, it's preventing blood from gushing everywhere. If you choose to, you can also put a 2x2 underneath the hub there in order to collect any drainage. Okay, so I've got my pressure. I'm going to go ahead and pull my IV off, and as quickly as possible, I want to pick this up. You see my cap still on there. I'm just pulling that off, and once I put the J-loop into the hub, I can release pressure. And then I'm going to hold the hub, the blue part, without touching the insertion site. And I'm going to twist this part of the J-loop onto the catheter to make sure that it's secure. Okay. Once I've done that, I'm going to go ahead and just kind of hold it. And I want to flush. I want to make sure that it flushes good, that there's no swelling, and that the patient doesn't complain of pain. So it's flushing good. If I need to, I can pull back to see if I get blood return, keeping in mind that not every IV allows for blood return, and you just have to know your policy about blood return for your IVs, as well as the type of device you're using. So my device doesn't allow for blood return. So it did flush good. I don't see any swelling. The next thing I'm going to do is I'm going to grab, while still holding the IV, I don't want the patient to move. I don't want the catheter to come out. So I'm going to go ahead and grab my tegaderm, and I can kind of brace that and use my thumb here or whatever in order to help me peel the back off. Okay, and then there's a little slit in this dressing. So the little slit there, that's where I'm going to put right here at the hub. And so you can see I'm putting the dressing over the insertion site as well as over the hub and slightly over the part that we twisted on, right? And so the insertion site's covered and protected now. So what I can do is I can go ahead and remove this top part, right? So I'm just going to peel that off, pressing the dressing down as I do so. I've got my little sticker here that I'm going to fill out. And then once I fill it out, I'm just going to stick it kind of over on the side of the tegaderm. Again, not over the insertion site. So finished flushing. It still looks good. I'm going to go ahead and remove my flush. And then I have my cap. This is my alcohol cap that I'm going to stick on there. And it just pushes down and twists. And that will help to keep anything from kind of collecting, any bacteria or anything from collecting on my hub. And then finally, what I want to do is I want to tape. I want to take my tape. And I just want to secure this J-loop so it kind of forms a J. I don't want to put this over the insertion site, but I am going to kind of put it over both parts of the tubing and kind of position this where I can get to it easily, right? The whole point of having the J-loop is so that I don't have to go close to the patient's skin. It's up here. I can easily maneuver it without having to pinch them or anything like that. Also need to make sure that your needle goes in the sharps container. And then we're going to get Mr. Smith all cleaned up here, and we're going to document. So we're going to document the size of the IV. So a 22 gauge IV inserted into the location. So the patient's left forearm or left lower forearm. Patient tolerated the procedure well. J-loop applied, as well as a swab cap, 10 mLs of saline flushed, no edema, no erythema, no complaints of pain. And then we can go and grab Mr. Smith's meds. I think it's time to get that IV out. What do you think? You ready to go home? All right, you know the drill. Tell me your name and date of birth. Perfect. Get my gloves on. So the coming out is much easier than the going in. So I'm gonna get my gloves on here, get your bed up so I don't have to bend over. You know, I'm getting old. Perfect. Get your roll down so I can get to you. Today. All right, you know the drill too. My students are back. You don't mind? Okay, perfect. So we're going to put this just pad underneath your arm just to protect your sheets and everything. All right, I've got a few things with me. So I've got some adhesive remover that'll help me to get that tape and stuff off a lot easier. I've got an alcohol swab just in case, some tape. And then I've got some 4x4s and some non-adherent pads. 2x2s also work. I just didn't have any of those readily available. Okay, so the first thing I'm gonna do is I'm gonna just kind of wipe around with my alcohol swab. Make sure everything's clean. And then I'm gonna use my adhesive remover here. These are very slippery. And I'm just gonna work this tape particularly off so it don't pull as bad. All right. And then I'm going to work on this tegaderm here again, just kind of stretching it as I pull. I'm going to make sure I hold your IV. my hand? All right, maybe. All right. The next thing I'm going to do is I'm going to grab just either a 4x4. I got my little pad here that I'm going to grab, and I'm just going to lay it over top your insertion site. I'm not going to apply any pressure, so I'm going to remove the IV. And once it's removed, then I'm going to apply pressure. If I apply pressure while I'm removing, oftentimes that causes worse bruising for the patient. So I'm just going to apply pressure. Wait a little bit. I'm going to open my other gauze here. I'm going to take that one off. It looks like we've stopped bleeding. I am going to apply another non-adherent pad and just some tape in order to keep that secure, and so that if it does bleed a little bit, we have something to catch that. Okay, did great. Do you have any questions for me? All right, so I'm going to document the IV was removed. One of the most important things when you remove an IV is that you document that the catheter was intact. And so we're looking at this part, this plastic part that come out of the patient to see, is it all there? We want to make sure a piece of it wasn't left in the vein, which could embolize. All right, so 22 gauge IV removed from right forearm, catheter intact, patient tolerated well, and we'll get you cleaned up and your bed back down and get you out of here.